Okay, hi everybody and welcome. I'm Emily Anderson, the founder of Mom Crew. I started Mom Crew when I was living in New York in 2019, and I used to host really fun in-person meetups for moms-to-be and new moms. And then COVID hit, sadly, so, pivoted a little bit, and I've just been doing all virtual events for the time being until it's, safe for everyone to meet up again. But it's also been really great doing the virtual events because it's allowed me to partner with a lot of different companies to provide very helpful information and educational types of events to expectant and new moms. And it still is a nice way for us to connect, even if it's, not quite as much fun as enjoying a beer with our babies in a bar. But all good for now. I wrote, or I said this already before I started the recording, but I wrote a little hello in the chat. So anyone who's just joining, please go ahead and introduce yourselves. You can just say where you are in your pregnancy or new motherhood journey, what you're looking to get out of this this talk today, any questions you might have, where you live, anything else you might want to share. And if any questions come up for you while they're talking, feel free to just add them to the chat and then we'll probably get to them at the end. Oh, and I have two kids myself. I have a 4.5-year-old daughter and a 2-year-old son. And we moved to LA actually last year during the pandemic. So I'm now West Coast. But anyway, so I've been through all of it twice before. And I look forward to hearing what Starling is going to share today. So with that, I'll turn it over to Callai, and she will tell you a little bit more about the company.
Hi, thank you. I am Callai, and I am a doula and a member advocate for Starling, and we are a place for you guys to come to get expert support through pregnancy and the postpartum period as well. I am also a mom of 2. My kids are older now, so also sort of like through the thick of it. They are 10 and 7. So I know that it's really common to feel overwhelmed during this part of your life, big time of change and transition. And so Starling is here to sort of guide you along that path. And we do it all from the comfort of your own home. So it is virtual, and we offer meetings every other week with a small group facilitated by an expert doula. And in the groups, you cover all sorts of childbirth education topics, everything from managing pregnancy symptoms to stages of labor, newborn care, postpartum recovery, breastfeeding, the list goes on and on. So at the end of the event, we'll be talking more about how you can join and special perks for those of you who are here tonight. And with me is Carly, and Carly is a certified nurse midwife, and she's also a mom. So I'll let her introduce herself.
Hello, thank you all for coming tonight. As Callai mentioned, my name is Carly. I'm a midwife, and my daughter is 16 months old, so kind of smack dab in the middle of the pandemic. For those of you who are pregnant, I can relate to some of the unexpectedness of that. And yeah, I'm excited to be here tonight and kind of talk with Callai on what we can all be doing to sort of prepare for this big transition and getting the team that you want to support you around you.
Yes, thanks. And that's exactly what we are going to be talking about tonight. So some of the topics that we're looking to cover is sort of understanding your options for pregnancy healthcare providers, discussing the differences between an OB and a midwife, discussing the role of doulas, how they fit into the care team, talking more about how to engage support from your existing community, talking a little bit about options for childbirth, breastfeeding, and newborn care education classes, and options for your postpartum support as well. And I think next we'll just turn it over to you guys for a second and ask what kind of support are you most interested in, why? So, are you looking for support more around the birth process, breastfeeding support, educational support, postpartum recovery? The list could go on. So we just want to hear from you. What are you looking for right now? What do you feel like is lacking for you? And you can just share that in the chat, by the way. No need to hop on and share your camera.
So I see somebody's bringing up the idea of a lactation consultant and how they'll know if they need that or if it's necessary. A lot of people talking about different care providers and different options, and wanting to know what postpartum doulas offer. Everything. People are saying everything.
All the things. Yeah. Not sure if we should get a lactation consultant ahead of time. Oh, the difference between a night nurse or a doula. That's something that's really interesting and like often I find very regional based. So I find that in the East Coast, they sort of refer to postpartum doulas often as night nurses. And on the West Coast, it's exclusively postpartum doulas, but we can talk about that a little bit more in detail later. Yeah, so Carly, let's get into this. So someone did mention they're wanting to know sort of like the options between like an OBGYN and a midwife, and you're a midwife. So it'd be great if you could just share with us sort of what you see as the difference between your midwifery practice and an OB's practice.
Yeah, thank you. That's a really great question. And a lot of people have that same question. So to start off, an OBGYN is a doctor. They've gone to medical school and done a residency specifically in labor and childbirth and postpartum, and as well as like some well woman GYN care. And they are typically have practices that are associated with a hospital. So sometimes they're private practice and they have specific hospitals that they deliver babies at. So if you have an OBGYN, often you'll be part of a group practice. There are a few OBGYNs that work sort of solo or with just one or two people that are able to guarantee that it's just them that's at your birth. But most commonly, especially if it's a more busy area, it'll be a practice. So it'll be a group of, anywhere between 3 up to 20 providers. And that's because, if they're up with people having a baby, they're not really necessarily able to do that for 5 days in a row. Eventually they have to sleep. So that's typically how OBGYNs practice. There's a couple different types of midwives, and the majority of midwives that practice in hospitals are called nurse midwives. So nurse midwives have a master's degree in nursing with a specialty in midwifery and women's health. And so nurse midwives, for the most part, also work in hospitals, but there are some places where there are nurse midwives that also attend births, either at birth centers or home births. So then there's another category of midwives that, depending on what state you're in, they're titled a little bit differently. Sometimes they're called licensed midwives, sometimes they're called professional midwives, sometimes they're called lay midwives, and sometimes they're just called midwives. So it's sort of all the sort of midwife category, or nurse midwife is the ones that can practice in hospitals. So the first kind of question you'd be thinking about, if you haven't already decided, is where you plan to have your baby or where you hope to have your baby. So for people who are planning to have an out of hospital birth, you'd have to search for providers that do that, which generally would be the professional lay certified midwives, sort of in the category that's not nurse midwives. And there is some exceptions, as I mentioned. There are some states and some places where nurse midwives also do out of hospital birth. So if you are planning to deliver in a hospital, then your kind of choice comes down to what are these two different care providers. I always sort of explain it as obstetricians are specialists in high risk and the pathologies that can come up during the birth process. So they have a lot of knowledge about all these things that could be happening throughout your pregnancy. And all nurse midwives will actually also have somebody that they can consult with that is an obstetrician, so should something come up. So a nurse midwife is the expert in the physiologic, normal process of childbirth and pregnancy and postpartum. So in most hospitals, the way that it works is the nurse midwife would be with you for your labor. They can prescribe your medicine. They can, or do your orders and deliver your baby, unless something comes up that's really outside of the ordinary and kind of pushes past what's safe. Obviously, for example, if you need a surgery, nurse midwives do not perform surgeries on their own. They can assist in surgeries and often will be the assistant in your surgery. But being the expert sort of in that normal process, the thing that I think really sets sort of the tone or the difference there is that there's a lot more of an ability for a nurse midwife to sort of partner in your care, and kind of comes from the nursing philosophy of joint decision making, which can be really, really great for some people. I'm going to give an example of, I know a lot about all the different types of pain medications, for example, but I don't know anything about a specific mom and what her needs are, or a specific birthing person and what their needs are in that moment. And so it doesn't matter how much I know, because I can never know the whole picture. And so that philosophy is really what tries to guide the midwifery care, or the model of care, is kind of saying, like, let's join together as we make these decisions about what's best and necessary. So I guess
just want to jump in.
Yeah, go ahead.
If I can really quick, because you've mentioned pain medicine a couple of times. And when I teach childbirth classes, sometimes I notice that people assume that if you have a midwife, you can't, for example, have an epidural. So as you mentioned, you know all about the pain medicines, and you can prescribe medicines, including pain medication for labor.
Yeah, so anybody can have an epidural if you're in a hospital and you want one, unless you have some medical contraindication. And a lot of people do seek midwifery care and want an epidural and know that 100%. But they just also often want maybe a more holistic version of the care. And that's not to say that an obstetrician can't provide that or doesn't. It's just not necessarily the exact training, if you will. It's more that, we are all trying to provide safe, healthy deliveries and safe, healthy care. Anybody on your care team has that same goal. And with a nurse midwife, you can get epidurals, you can get any sort of pain medication that's offered at your hospital or place of birth. But yeah, so it's sort of like a philosophy difference, I would say. I don't know if that answered your question.
Very, very thorough.
If you have more questions about that, you can type them into the chat and we can see.
Yeah, definitely. And what would you say to people who are hearing your spiel about midwifery and thinking, oh my gosh, that sounds so great for me, but are already settled in with an OB practice? Because I think a lot of us, before we're pregnant, we have like a gynecologist who's maybe an OBGYN, and we already go to them for like our pap smears and our well women care. And you sort of don't hand pick them because you think they're going to be great at delivery. And then once you're pregnant, I know a lot of people feel stuck, or at least I did with my first. I was going to an OB and I was like, well, I guess this is okay, but I think I'd prefer a midwife. But I felt like even at fairly early on in my pregnancy, 12 weeks or so, that I was already too settled in and couldn't switch. But then I ended up in a really funny position. Well, and it was kind of dramatic and I won't go into it, but I was laid off from my job and I lost my insurance. And the new insurance, my only option was to go with a midwife, and it ended up being amazing. But I don't think that I would have been sort of bold enough to make that change for myself.
That's a really good question, Callai. And in our 7 Starling groups, this actually comes up a lot, because people, even much later, you said you were thinking about it at 12 weeks, even, 28, 30 weeks, people start wondering, do I have the right care team? And I don't think it just has to do with if you want to switch the type of provider that you have. It could be that you are noticing that there's not a fit with you and the person that you're seeing in the office, or that you have a new goal that's come up as you've learned more about sort of what you want in labor. And I would really encourage everyone to, just take a moment and check in with yourself. So for some people, trying to make that change and the mental effort to really do all this research might be too much for them to handle at that time. And that's okay. And if that's your situation, then I would really think about, and we'll talk about this later, but think about your preferences for birth, think about birth plan, and then try to have those conversations early. If it is something that you feel really motivated to do, most people will take transfers of care up until after 30 weeks, often even up to 34, 36. So do some research of people who are local, people who are around. You can always call the hospital and ask them, do you have any nurse midwives that deliver at your hospital? What is, how do I get a hold of them? Or ask in other forums. So I think if it's something that you feel really committed to, if there's something that's not feeling right, one of the most important parts of having a good labor and birth experience is feeling that you have open communication and trust with your provider. So that's not going to be limited only to midwives at all. Of course, there's many wonderful, wonderful OBGYNs who will fill that need for you. But no matter who your provider is, if it's not feeling right, kind of try to honor that and see what options you can find.
Yeah, and I see we have a question in the chat that's saying, you know, like, how do you tell if someone is a good fit for you or if there could be someone better out there? And I think, you know, it can be hard to tell because when we see our doctors in like a normal visit, you know, like, you know, just going in for a checkup or like I mentioned before, a pap smear. I feel like I never go to the doctor except for a pap smear. That we expect the visits to be short. We expect, you know, not to spend a ton of time with our care provider. And if it's just for like a simple issue or a simple test, that's okay. But I feel like pregnancy is this whole emotional, physical, psychological process of change. And some people do feel like they want more support from that. And then they go to see an OB, or, you know, sometimes midwives are like this too, especially if they're at a really busy hospital practice. And they're like, oh my gosh, these visits are only 15 minutes. I don't feel heard. I don't feel safe asking questions. So what advice would you have for someone just, you know, looking to like interview someone or find someone who's a better fit?
So some practices do have the opportunity for a phone conversation or an interview. You can always schedule an appointment. But what I'm hearing you say and what I have lived and is very correct is that our medical system is not set up, unfortunately, to have these like really long and in-depth connections often in prenatal visits. People have a lot of, you know, they have to cover your labs, they have to look at your ultrasounds, they're trying to make sure everything's safe. And sometimes there's just not enough time. And so I think this kind of brings up one of the things that we are trying to address at Seven Starling is a place where you can bring all those questions and bring all that, you know, just wondering like the what ifs. And so I would say you can interview, you can call a practice, you can always call and ask the MA, like who's the midwife in your practice that you recommend, or ask them, is there another doctor I can see in the practice that, you know, maybe has a different style. So you can definitely try to move around within the practice or check to see if there's another practice locally to you. I also find that people, when you write your questions down ahead of time and you go into your visit and you even can hand it to the medical assistant before the provider even comes into the room, sometimes they'll have a better chance of sort of addressing those things with you. It's hard. You're bringing up a point that is definitely, I think everybody in birth work, all care providers really wish we had more time and quality connection. But sometimes, as you mentioned, it gets tough.
Yeah, and I do think that is one of the reasons why doulas exist as a profession. And, you know, Seven Starling is sort of based in that idea of providing more emotional and informational support that people maybe can't get from their doctors or their midwives just because of, you know, time constraints and stuff like that. And there's another interesting question in the chat that saying like, is it a myth that midwives are against giving epidurals unless a person is really desperate? So you were sort of mentioning how midwives want to be really collaborative in the decision-making process.
So I would say categorically that is a myth, and that is not at all how I have seen any of the colleagues that I've worked with practice. I think because there are people who are really committed to unmedicated births, and frankly, having a midwife, having a doula, having a lot of informational support leading up to your birth is really likely to increase that, and it will be very dependent on what hospital you're in or what birth setting you're in. Because people who do want unmedicated births seek out these professionals doesn't mean that they aren't amazingly supportive and useful to anybody who knows for sure that's not their plan. Some people even know that they're planning to have a C-section and their prenatal care, they'll continue with a midwife. The tools that we have on labor and delivery are all appropriate at certain points. And pain is always what the patient says it is. Pain is always a subjective experience. And if you are in need of relief, then it is our job as providers to help you. And that may be suggesting a shower or suggesting movement, but it's definitely not anybody's role or intention to discourage you from something that is safe and available to you. So I would say, you may find a one-off experience or hear something that supports like another myth, but it's really important, again, to check in with your provider, check in with your midwife, check in with your doctor, check in with your doula who knows the local hospital, and find out what support you'll have, because like your experience is the only one you're going to have, right? And so we want to make sure that that's being honored, like your wishes.
Yeah, and I think a lot of times too, in a hospital setting, a doctor or a midwife will write you what is like, I think the right term is a standing order for an epidural, meaning that if you decide you want to have an epidural, all that like paperwork is already in the computer system, and it's not like the midwife has to give you permission.
No, I think in general, there's very little reason why people would encourage you or say that, that wouldn't be a possibility for you. One of them might be if your baby's literally coming out already. So if your baby's head is already crowning and it would be impossible for you to sit up on top of that, then that might be an instance. So it's not to say there's never been an instance where somebody has said like, I'm sorry, you're not a candidate for this. But overwhelmingly, especially 100%, especially if you're a first time birther, there should be time for you to get an epidural. There should be the availability for you to get that if that's what you want. And I'll say just a quick caveat on that is that some people start off thinking they are or thinking they're not going to want something, and that can change in labor. And so your provider should also be able to be flexible with whatever that is. If you came in being like, I 100% want my epidural, I'll let you know when I want it, and you get to 8, 9, 10 centimeters and you're like, oh, actually I think I'm fine, that should be okay. Nobody should be pushing it on you. And likewise, if you thought, no way, I don't want to be strapped to the bed, and then it gets to a point where your labor is just, you're unable to relax, you're unable to let
They're
your
usually
baby
the
down.
long ones too.
Yeah, you might need that. And that's totally, like, every provider is going to support you in that.
Yeah, and most doulas will as well. Again, we can't speak for every single one, but I think that's another common misconception about doulas is that they're only for people that want to have unmedicated births, or that they're going to push you or bully you into giving birth the way they think is best or something like that. And it's not true. I think most of us who are in this birth work field just want our clients to have a really positive experience, and we recognize that what it's a positive experience for me is not necessarily going to be a positive experience for someone else. And we just want to meet you wherever you're at with just completely non-judgmental support. And so I would like to pivot a little bit and talk a bit more about doula care. And I do see some questions in the chat coming up about that. So, a midwife is there to take care of the medical things, like listening to the baby's heart rate, prescribing medications and things like that. And the doulas are more on the emotional side of the spectrum, right? So doulas do not perform any sort of medical tasks. They can't check your dilation or anything like that, but they're there to support you during either the labor process or postpartum. We'll sort of talk about that separately, but for the labor process, for example, to help you feel really informed, like you're making best decisions for you. I'm certified through the International Childbirth Education Association, and their motto is freedom of choice through knowledge of alternatives. And I think that's just a really great way to sum up doula care a lot. So we always want you to know all of the alternatives available to you and help you make that decision. And we don't usually speak directly to your care team on your behalf, but we help you be an effective communicator. And then we are also there to provide practical support, right? So to push on your hips, squeeze on your back, give you a shoulder rub, to suggest position changes or other coping techniques, breathing strategies, things that can help you stay a little bit more comfortable in labor and have a productive labor. So, and how does that work with the OB and the midwife? I, as a doula, always just want to be as helpful as I can and I love feeling a part of the care team. But at the same time, if the doula, or I mean, if the OB or the midwife is in the room, I feel like to a certain extent, I sort of like fade to the back, right? So I'm not getting in between my client and their care provider. And how do you like working with doulas as a midwife?
You know, I love working with doulas. I suggest to everyone, you know, it is such a benefit, whether, again, like I said before, whether you are 100% planning an epidural, whether you're planning a repeat cesarean section, if you've had one before. I think, as you mentioned, you know, there's a 3 components. It's like emotional support, physical support, and informational support. And I think the emotional and the informational support can start so early in pregnancy. It can be so helpful. There's so many questions that come up that aren't just about that 24 hours when you're actually in labor or actually having your baby, right? Like you said, to provide those options, you know, reviewing that stuff, talking about it over and over again, and thinking about what is it that makes sense for me and my family. And so I love it, because also, as you mentioned, you know, sometimes there's, you know, in a hospital, things can get busy, and there's going to be one midwife that may be taking care of multiple patients, and your doula is somebody who's dedicated to you. So whether that's physically in person or by text, or helping you develop your birth plan leading up and giving you the words to ask and advocate for yourself, or ask for time or explanation, I think that can be a really empowering thing.
Yeah, and doulas also provide a continuity of care that I think is really missing in most hospital settings. So even if you have a midwife, I know most midwives, or not, well, I won't say most, a lot of midwives work as like hospitalists, in the sense that they work on call shifts. So you can expect, if your labor is long and you're in the hospital for, you know, 24, 48, 36 hours, to see several shift chains come around where you're having a new labor and delivery nurse, a new midwife, or a new OB who's in charge of your care, where the doula is like the one sort of person who's going to be there with you from the beginning to the end, and stick it out.
Yeah,
and
I think it's a helpful, I think it's definitely, you know, I know having that in-person labor support can be absolutely fantastic. For a lot of people, you know, I know right now hospitals are limiting visitors in some way. And so having that sort of lead up to developing sort of your plan, developing your preferences, developing your voice, I think is something that I've been like so grateful to the doulas that I work with to help. You know, I'll have patients who will say, oh, my doula said to bring up this possibility. And I'm like, that's a great option. Like, let's grab that peanut ball out and use it right now. And I think that's just knowing the options is a really great empowering tool.
Yeah, definitely. And you know, of course, doulas range in their experience, but you know, if that's something that you are searching for in a doula, an experienced doula has the benefit of having seen many births with many different outcomes and many different twists and turns, and can really help just normalize the process, you know, just like reminding you, like, yeah, this hurts, and it's really normal to feel this way. It's normal to cry. It's normal to throw up. It's normal to feel overwhelmed. And also to be sharing that information with your partner. Because I think a lot of times partners during labor really struggle with seeing the person that they love in a very intense situation. And just to have that little voice saying like, she looks miserable, but she's actually doing great, I think is helpful anyway. At least I hope it's helpful.
Yeah.
Yeah.
I'm wondering if there's any other, I see a couple other questions coming through the chat, or if you had another question that you had wanted to ask here. I see whether to get the right doula if the same doula does the prenatal, labor, and postpartum, or if there are different specialists for those.
Yeah, so we can definitely talk a little bit about postpartum doulas too. So there are some doulas who offer labor support and postpartum support. There are some who only offer labor support and some who only offer postpartum support. And so the postpartum support is a little different in that the doulas do typically work in shifts. You know, so I was mentioning the labor support, it's not really a shift. We just join you whenever you're in labor and stay until that baby's born. Postpartum doulas will typically work a daytime or a nighttime shift. The nighttime shifts are usually like a whole 8 hours. The daytime shifts are usually shorter. Like on average, I've seen anywhere from like 3 to 6 hours. And they're there to be sort of like an extra pair of hands around your house. They usually will do a lot of the like mothering the mother tasks, things like preparing you meals, making sure you have water, getting you a footstool to keep you more comfortable while you're breastfeeding. Then they're there to also help you feel confident as a new parent. So giving you tips and tricks about baby care, soothing, breastfeeding, burping, and also they're just to be a listening ear, someone who you can open up with, who you can share with, talk about, oh, this is harder than I thought it would be. And again, they're that normalizing presence saying like, yes, all of my clients say this, it is really harder than we think. And I think having that postpartum support is really important and really lacking in society. And that's one of the reasons why 7 Starling groups, people can join anytime in pregnancy, but it continues all the way through their baby's first year postpartum, because we talk so much about birth plans and labor and all of that, and tend not to plan quite so much for the postpartum. And that's where a lot of people find that they really needed the most help, I think.
You mentioned like being an ear, and it just makes me think, in your experience with your clients, how often are you helping people process just the pregnancy, birth, and postpartum experience?
A lot. I mean, that's a big part of it. I find like there's always like these patterns that emerge. Like if people go over their due date, there's this amount of distress that people experience, and a lot of anxiety and things to work through there. And then, birth rarely turns out the way we sort of like hope and plan it will. And so usually with clients, there's a lot of need to sort of discuss, like you share your birth story, like, oh my gosh, I can't believe that just happened to me, going through the events, and your doula is there as kind of a witness. But that's another good thing about being a part of a mom group, is that you can share that huge transformative experience that just happened to you with people who understand.
Yeah, I think it's such an important thing, that the idea of processing the experience, because it is, I see so often in births, the birthing person will have their own mother there, and their own mother like can't stop bringing up their own sort of birthing experience. And it's
Yeah.
really apparent they never had that support group to really process it, or that the place to like think about like, wow, what was it like to feel like I didn't have control, or to feel like, this unexpected thing happened, or this emotional like, woof. So I love that, that's part of kind of what doulas can help guide people through that processing, and support groups, and having your people to really like, to really let that moment be processed properly.
Yeah, and I'm seeing more questions about sort of like who are these people who are around to help us postpartum, and sort of this difference in terminology, right? So we mentioned before a night nurse versus a postpartum doula, versus there's even another one which I haven't heard mentioned here, which is a newborn care specialist. So like Emily shared that like her understanding of a night nurse was that they're there to just like care for your baby during the night so that you can sleep, like to bottle feed the baby, to change the baby, just take care of all of that so that the parents can get rest. And that is definitely true with the night nurses. And sometimes people who are night nurses actually are registered nurses, but not necessarily. So if that's something that you're interested in, like you just really want that hands-on support, someone caring for your baby during the night so that you can sleep, I really recommend that you look into their certification process, into their training. Are they actually a nurse, or are they just calling themselves a night nurse? Because a lot of these terms are kind of nebulous, right? And then a newborn care specialist also focuses primarily on the baby, but postpartum doulas are concerned a little bit more with caring for the whole family, and again, that mothering the mother notion. So I hope
and so it kind of sounds like what I'm seeing from the chat, and also from what I'm hearing from you, is, depending on your region, depending on what exactly it is you're looking for, you might have to put in a little bit of research, a little bit of legwork to find out, is this person coming to do the thing that I need? Or is this service providing what I'm expecting? Does that sound right?
Yeah, definitely. And yes, and unfortunately, like the lack of like standard terminology does make it a little bit more tricky for the parents, but just sort of being aware that like the postpartum doula, you can think of them as caring for the whole family, mothering the mother, and helping with newborn care. Newborn care specialists, that is a name that's a little bit more, self-explanatory, are there to primarily care for the baby. And then night nurses, or sometimes they're even called night nannies. Oh my gosh, I'm just like more terminologies running in my mind because I've worked with like doula agencies and stuff for a long time. So I've heard all of the phrases, again, are more focused just on working those night shifts, helping parents get some more sleep. And they can be very pricey as well. So a lot of that can be limiting, where the overnight support especially can be expensive, where you might find you can't afford a night nurse, but you could afford a daytime postpartum doula who could hold your baby while you take a nap, help you make dinner, do a load of laundry for you.
Yeah, I think that brings up the point, if you're right. Some of these things can definitely be quite pricey, especially overnight support. But I think what I always try to guide people on is like to kind of use this time, like, especially if you're still pregnant, like to plan ahead on to see, what are the tasks that I'm anticipating need to be done? What are the things that would be helpful? And then who in my support network already can do some of those things? So if you have the opportunity to hire, somebody to do everything, then that's one option. Some people don't feel comfortable with someone that they don't know sort of in that vulnerable period or in their home. And so I always say, like, make a list of all the tasks that you do on a daily basis for a week, right? And if it's emptying the dishwasher, if it's doing laundry, if it's walking your dog, all of the things, making the food, planning to make the food, going to the grocery store, and trying to think about who in your network can kind of help you. And I think that is another thing that, we try to address in prenatal care as midwives. I know in 7 Starling, we try to address it in our groups. And I think doulas also kind of give that guidance of planning ahead.
Yeah, definitely. And, I think, again, back to like, I feel like we keep talking about planning and like birth planning versus other planning, but having a postpartum plan is important. And I do want to talk a little bit more about ways that we can engage our existing support circles. But there was another question really quickly about postpartum doulas or birth doulas as well, and how partners feel about that. Like, do partners feel like that's weird or, stepping on toes? And I can just speak, from my experience as a doula. A lot of times partners feel like, I don't really get why you're here, but my wife, my partner wants you here, so I'm okay with it. And then what I try to do is make them look like the hero of the moment. So I think most doulas care a lot about maintaining the closeness of a couple during this challenging time of transition. And so like in a birth setting, your doula might be whispering to your husband, like, oh, look, I can see her shoulders are tensing. Go rub her shoulders. She'll think you're a genius for having this idea. So trying to help partners be really effective. And then when they look back and they talk to me later, they're like, oh my gosh, thank you so much. Like, I felt like I was so much more involved. Whereas when I thought that with you there, I wouldn't have anything to do. So most doulas do really want to engage partners. And same thing with a postpartum doula. I think before you've had children, it's really hard to wrap your head around how you could need more than 2 adults to care for a newborn, but it is just the work is so overwhelming. So I think most of the time, even if partners feel skeptical about it before they're actually parents, once they're parents, they're like, yes, we need all hands on deck. We need all the help that we can get right now. And then go ahead, Carly.
No, I was just going to say, I think it's possible, right? Like, everybody is different. So you guys are asking these questions and they're fantastic questions. I mean, this is something that also, again, comes up very frequently in groups, is like the partner feels one thing and the birthing person, has a slightly different set maybe of priorities or needs or thoughts about what they might need going forward. And I think you don't have to decide right now what your plan is then, right? You can do the research to find somebody, you can talk with your support groups, you can talk with your extended family and friends. And we actually dedicate an entire session to kind of talking about this, like this postpartum planning in our 7 Starling groups, because all of your questions are so not naive. Like somebody said, I don't want this to be naive. You are not naive. Comes through every single person's head. And we can't answer for you right now what your partner is going to feel about somebody in your space, right? But we can help you learn to ask the right questions and think together as a team about, well, so maybe we don't hire somebody before we have a baby, but maybe we get a couple names, and maybe we keep this ongoing list of what we'll need to get done. And if we start looking at it and saying, no way, can we do this? Then we'll know it's time to give that person a call. So, thank you all for sharing this, because it really is, again, not naive at all. This is about the most common as it gets, to wonder, what is this going to be like? How is my person going to react? How is my sweetie going to feel with other people in our space, in our birthing room, in our postpartum bedroom, perhaps, in our kitchen? And this, like, navigating those relationships is a huge part of this transition.
Yeah. And I do hear people that I speak to and clients say a lot, like, we don't want to have family come and visit us right after our baby's born, because we want it just to be the 3 of us. Like, it's going to be this really magical bonding experience, and we want it to be like really private. But that always makes me feel kind of nervous, honestly. Like, just being a mom and knowing it is a special time for your family, but you just really need the help. So it's a time to, sort of take up your in-laws on those offers to, like, come and visit, like, come stay at an Airbnb near your house and help take care of you during the day. And the bonding will still happen with other people there. Actually, it might help happen better with more support around.
Yeah, I will say, I have had people say that about wanting to kind of protect their bubble. And I do hear, we are in a pandemic and it's scary. And again, I had my baby right in the beginning of the pandemic, and they were like, no visitors, nobody can come. People were still wiping their groceries down with, like, the disinfectant. But we were able to navigate that, and thinking about, meal trains where people dropped, this was, like, very sad. Like, you're showing the baby through the window and you're dropping off the food, but in a way, like, that was okay too, like, if that's what the main need is for your family, think about how, like, somebody can maybe help with the grocery shopping, and somebody, if an outdoor walk is, what they want. I will say, to your point, Callai, if an in-law was to show up at 7 a.m. and say, I'll take the baby on a walk for an hour and a half, I doubt there would be a lot of pushback at that hour. So there's ways to arrange kind of meeting everybody's needs, but thinking about your needs and thinking about your partner's needs, and knowing they might not be in line with what somebody else says, and they might not be what your sister or your best friend needed, and kind of staying flexible to what comes up for you.
Yeah, definitely. And what do you recommend, like, as a medical professional, as a nurse, in the time of a pandemic, for people allowing different people into their home around their newborn, who of course can't have the COVID vaccine?
Yeah, well, so the newborn cannot have the COVID vaccine. Luckily, it seems like, based on some of the information that we're getting, as vaccinations are available and completely safe for pregnant people, that the pregnant people themselves can be vaccinated and protected. It seems like booster shots are going to be becoming available for at-risk populations, and I think that is set to include pregnant people. So getting that vaccine during pregnancy also boosts your baby's immunity when they're born. Breastfeeding can boost their immunity. Sort of the same thing that we say about flu and Tdap, is the people caring for the baby or that are going to be holding the baby should be up to date on their vaccination. So that's, like, the kind of absolute. And that sometimes can be hard to advocate for your family, right? If your mother-in-law has a really different opinion about getting the flu vaccine or getting the COVID vaccine, you might have to kind of discuss what you're comfortable with. Always, having that sign again by the door that's like, thank you for washing your hands, having your sanitizers around your house. But it's really personal, because those first few weeks, your baby is just so new, and getting a respiratory infection would be very tough. So keeping in mind whatever your local guidelines are at the time. And if that's that, an unmasked person that isn't vaccinated shouldn't be, sharing space with you, then I would say trying to think about other ways. Maybe a stroller walk is something that a family member or somebody who maybe doesn't take the same precautions as you could do outside, and let you take a shower while they walk around the block in a breezy environment. But it is hard, we know in these first weeks that we are really trying to protect the babies. So I would say talk with your pediatricians, talk with your care providers about, what's local, what's being recommended at that point. Somebody asked me about how is it now with my baby. It's a little bit different. She's a little bit older. Yes, we still are nervous, but that newborn stage is like, it is a cocooning stage, right? And so having like a sip and see party where 40 people come over to your house is not recommended.
Yeah. And I think another thing that you can do if you want to have people around to help, but like don't feel comfortable with them holding your baby, is to wear your baby in a carrier, like a sling or those wrap style carriers, because they always look a little more elaborate from the outside than they really are, to use. And so people are less likely to be like, hey, give me that baby, when the baby is securely fastened to your body.
Yeah. And that's why I like better the idea of like a meal train or a grocery chain, or like, somebody who's willing to come over for nap time so that you can also nap, and they can do, a load of towels, laundry. Because it shouldn't be that you are hosting. It shouldn't be that you're entertaining. You shouldn't be scurrying to get out a fruit plate for somebody, right? The people who you're inviting into your space should be people that are, putting back together what has been kind of unraveled in this process.
Yeah. I think that finding support like within existing communities is really important. And I know in like 7 Starling groups, we talk about identifying a circle of care. So thinking about the people who you do really trust, like who are like very cautious with COVID or other, with the flu, like have their flu vaccine and stuff like that. And like the way we think about the circle of care is that, you're imagining concentric circles, you're in the center, and then you've got your inner circle, like those people you really trust, like who you'd be comfortable seeing you go to the bathroom. And then your outer circle is the people more like your coworkers who want to be really helpful, but you'd rather not them come inside your house. So doing things like meal trains, or like a scheduled Zoom meeting where people can see the baby over video, things like that, to stay within your comfort circle. And then the last ring of support there is professional. And so we've talked a little bit about doulas and postpartum care, but there are some other, postpartum professionals. So thinking of, in particular, lactation therapy and pelvic floor care. Can you talk a little bit about that? I know we're really close. We've only got about 6 minutes left. So
yeah, we just have a few minutes. So to answer your question about that, is there is going to be a large group of people that are going to support you in this postpartum period. And that's going to be your personal connections that you have. And that's going to be some professional connections. And really, if you are having anything that is bothering you and is uncomfortable and is painful and is new postpartum, we always say check in with your provider, because you may need a physical therapy referral. You may need, further help with lactation, even though you're a few months out. And I really, I know that we have to be brief here, but I would say that is something that is really important, that again, that you have a care provider that you trust. Or, one of the things that in our group, so at 7 Starling, you have a group of people that are paired with you that are around the same gestational age. So you're going to have an automatic group of people who you can bounce ideas off of, but you also have an expert doula who can help guide you to know, is this a medical thing that I need to talk to my provider about? Or is this something that, maybe with some comfort measures, I can kind of work out, or maybe they can suggest something like, if you're a few months postpartum and you're having painless sex, they can say, oh, have you tried this lube? Have you tried this position? Have you thought about these things? Or maybe they'll say, I think you should reach out to your OBGYN or your midwife and see if you need an evaluation. So that's a really great resource to have kind of both sets of those worked in. For the groups, we meet every 2 weeks. So you can write down your questions in your phone and bring it up. But if you have something that you want to know now, or you just want to get people's opinion, we actually have a chat function that you can pop in 24 hours a day, throw it out to the group with nursing or bottle feeding new parents. There's always somebody up. So if you throw out a question at 3 a.m., somebody's going to be answering you because your cohort of people are all in it with you. So I would say, I don't have a specific answer to that question in terms of exactly how you get that support, because it can be really different for everybody, but setting up that group of people is going to be crucial, and kind of taking that plan.
Yeah, and I do also want to mention that with the 7 Starling chat app, you can definitely chat your small group whenever you want. And like you're saying, there's always someone up feeding a baby all around the clock, but you also can chat your dedicated doula directly. So if it is a more sensitive question, like about pelvic pain or incontinence or any of the tricky body things that are going on, that you'd rather just get that one-on-one support with, that is available to you as well. And the doulas do their best to answer questions really quickly.
Absolutely. And also, you're probably not the only person experiencing it. So
yeah,
kind of like these questions people post here today, you are not alone. These are topics that come up every single session in our groups. So you're not alone if you're brave enough to ask.
Yes, so true. Someone has to be the first brave one to bring it up, to bring up all the sex questions and the leaking breast questions, right? All right, well, wrapping things up, Carly, I know, I feel like we covered a lot of things, but I would love for you to leave us with 3 sort of top takeaways that you want our participants here to remember, to share with others going forward as they're working on planning for their care during pregnancy and postpartum.
Yeah, so I like, when I think about the planning, I separate it into a couple things. I think about the tasks that you're going to need to get done. What I mentioned earlier, think about all the things you do around the house in your day, and starting to think about who can help with those things. So whether that's a doula or a neighbor or a parent or somebody that can help. So really separating that out and thinking, who is going to be my support? And then really separating the topic of your emotional support and thinking about, who can I call at any hour of the day sobbing? Who is going to support me in my anxiety as these transitions come up? And finding those people, identifying them ahead of time, letting them know kind of where you're at in your journey. And then I would say, in terms of planning, the thing that I think is crucial for everybody is how to get yourself in the mentality to be ready for some unexpected stuff. And you can have a birth plan, which we didn't get a chance to go too much into tonight, but you can plan out all the things you want or don't want in your birth, or want or don't want postpartum. And 100% of people that I have worked with, or that I know personally, have had something unexpected come up in that plan. And so the phrase that, you shared with me is sort of thinking about the flexibility and grace. So how can we have the flexibility when these things come up to let it be different, and to recenter ourselves and still feel empowered when there's some new information or something new happens, and how to have enough grace with ourselves to accept that that's okay if we need help that we didn't think we'd need, if we thought we were going to be diapered only with cloth diapers and exclusively breastfeeding, and a few months in you're like, I might need a different solution. So really giving yourself permission to accept those changes, but thinking about ahead of time, how are you going to be able to do that? So mindfulness and using your breath and relaxing. So I would say those are the 3 things that I would have people take away as they're planning for this transition.
Yeah, I think that's great. And I think that, that emotional support too can take in a lot of forms. And I know in the Seven Starling groups, we recommend that people identify a parent in their life who they sort of like their parenting style and who they can turn to for questions. And I was lucky enough when I was a new parent, when my second was born, I had a friend with two kids the exact same age as my kids, like days apart. And I knew I could talk to her about anything, text her in the middle of the night. Oh, my husband's making me so mad today. And identifying those people who are already there in your life is, I think, really important going forward into your parenting journey, because I think we never had to rely on our village as much before, and it can feel weird to do it, but most of those people in our life really do want to be there for us and want to help us.
Absolutely. Yeah, I think all of these are just so important. And I think that's why I love working here at Seven Starling. I love being part of something that is really providing that support to people, because sometimes there are things that you don't want to talk about with your immediate family or friends. And, especially like what you mentioned, some of the body stuff. It's nice to have somebody who's right there along with you. And I think you mentioned all of these fantastic things about doulas, and I also second and third that. We love having that support available, but because of the prices that we mentioned, Seven Starling is only $37 a month, and it provides all of that information, all of that support, dependable times that you can keep coming every 2 weeks to get those people together. And so I feel really passionate about that we are able to offer people that support.
I love it too. I always tell people that I wish that I had it when I was a new mom, especially with my first, because I was so isolated. I was living in a town with I didn't know anybody. I was a youngish mom, but I didn't know I was a youngish mom. I wasn't aware that people in the Bay Area didn't have babies until they were closer to 40. And it was hard. It was really hard. So yes, I'm glad that we can provide this for people that they can have a better experience than I had.
So yeah, I guess, I don't know if for those of you who are interested in either learning more or figuring out what group you would match with, you can head over to sevenstarling.com. And I think, Emily, you had mentioned the codes for how people can access a discount.
Yes, exactly. So for attending the event, you can use the promo code MOMCREW at sevenstarling.com, and that gives you 15% off of your membership. And you can join anytime during your pregnancy or in the early postpartum period. And again, with that membership, you have access to our app, which has daily learnings to help prepare you for birth and parenting. You get paired with your expert doula who's there to answer your questions anytime, and with a small group to provide you with community.
Great. Thank you guys so much. This was so helpful. I will pop into the screen very briefly. There was so much good information shared. I hope that everybody got a lot out of it. I know there was a lot covered in an hour, which is amazing too. I will send out a follow-up email to everyone who registered. I'll include the discount for Seven Starling. It does sound like a really affordable membership to just get, a lot of support throughout your pregnancy and new motherhood, and be able to ask those questions and get answers from professionals and fellow moms, which is great. So thank you guys again. Have a good rest of your day, everyone. And hopefully I'll see you again soon.
Thank you so much for having us.
Bye.